Steed, and welcome to Rolling Out Health IQ. This evening, I'm joined by my wonderful, very diligent, dedicated host, Dr. Sherry Blake, Dr. Kenyatta Stevens, and of course, our famous and influential who says, of course, we must not ridicule each other or be ashamed for having discussions about mental illness. That is my dear friend, Shanti Das. Thank you, ladies, for joining Health IQ. This is Mental Health Awareness Month. It is our time. It is a conversation. For those that don't know, Dr. Kenyatta Stevens is an epidemiologist. And there's a mindset that we all hope that you're able to reframe, reset once you've heard. Dr. Blake, we'll start with you. Okay. A temperature reading on the mentality of our community right now, during this month, during a pandemic.
It's very unfortunate. First of all, thanks for having me on. I'm happy to be here. But it's very unfortunate because a lot of people, I think they don't think it's going to happen to them. So they are business as usual. And we are dying in unusually high rates. And the reality is that until we get the message clear that it can and it will happen to anybody, I think we're going to continue to have a problem. And that's a major problem. And it's a mindset.
You know, same question for you, Shanti.
Oh, I mean, it's just so much going on right now. I again, kind of echoing what Dr. Blake says, people don't think that this thing is real. And, you know, from what I see, even just scrolling through social media, I am just really disheartened at the behaviors of certain people in our community who are in the clubs acting like it's 2019 or 2018 or 2017. And for someone like me, my mother is in a facility and she suffers from Alzheimer's. And the one thing I've been just praying is that her facility stays COVID free. But you have caregivers, you know, who go out and hang out. And I'm not speaking specifically to my mom's facility, but when people have other jobs and other people's lives in their hands and they go out and then they go back into these places of work, they don't know what they're spreading, right? They could be asymptomatic. And I'm sure Dr. K will talk more about that. But it's really frustrating. And then when you see those real stories of people who have lost sons, daughters, grandparents, cousins, you know, to this thing, like the Broadway star who just succumbed, you know, to COVID-19 and passed away over the weekend. It's like so incredibly sad. And I'm like, what is it going to take for people, especially in the Black community, to like wake up? Like, we're the ones who is affecting the most. You know, we're dying at disproportionate rates. And it's so frustrating that some of even my peers, they just don't get it. They don't understand. And I'm the girl that has the gloves, the mask, the face shield. I mean, y'all can laugh at me. You can call me whatever you want to. I could care less. But I'm trying to stay healthy for myself and for my family and for my community.
Dr. Stevens?
Well, you know how I feel, Munson. I have been kind of talking about this since March on this show. Just how if we don't really change our behavior, and especially in the Black community, and take this seriously, that we were going to end up right where we are. And we are in a place now where the virus has mutated, it's more easily spread, and the young people feel invincible. And they are taking it home to loved ones.
So it's Mental Health Awareness Month. There are stigmas inside and out. Taraji commented today talking about the strong woman syndrome is detrimental, which I'd like for each of you to talk about the stigma and the strong woman syndrome and its impact on our community and mental health. We'll start with you again, Dr. Blake.
Okay, I'll definitely take that. I always talk about women in terms of we wear a cape. We are the superheroes for everybody. We take care of everybody. We're running here, we're doing that, but we don't take care of ourselves. And it's interesting, her comments about the strong Black woman. I think we have taken that on as a badge. We've taken on that role, and we're sort of proud that we carry the load. We do all of this stuff. But the problem is, emotionally, we don't take care of ourselves. And while we're taking care of everyone, that what we have viewed as positive is weighing us down. And the superwoman cape that we wear is become our identity. And without that, a lot of times people are lost because they don't know how other people will view them if they're not the one to take care of it or fix it or do the. And the reality is, we have to take the cape off. We have to drop the strong woman syndrome and be a human and realize that we're vulnerable like everyone else. No, without question, we are. It's great, but on the other hand, we have to understand that we are human and we can't take care of everybody at all times. And we run, as Black women, let me just say this, we run on E, on empty, without a reserve, 24/7, most of us. And that's a problem.
And that's a period, exclamation mark, without a question mark, you know?
Unfortunately, but it's hard. It's
Yeah,
hard.
I agree. The stigma, Shanti, we are ashamed. We are quiet. And then it impacts us how? Can you share with us at this moment and just kind of share even why you brought your organization full circle and why this month is really important?
Yes. So this notion of being strong Black women, right, is something that I think historically we have, I guess, worn that title, if you will, from the days of slavery through Jim Crow to present day society. And I, for one, used to want to live up to that. You know, once, and I come from the entertainment industry. I had a very long career, a lot of late hours. You know, it was team hashtag no sleep. The longer you worked, the more accolades you got, or the more people celebrated you. And I felt like I was always neglecting my health and my wellness, and especially my mental health. My father took his own life when I was 7 months old, left my mom with 3 kids to raise. And I don't blame my dad, but I saw my mom cry and suffer for years. And we didn't go to counseling. We didn't talk about it. And my sister and I would often talk about how my mom was depressed, but she worked at night and, you know, did what she could to help raise her kids. And again, you know, just being that tough woman. But at the end of the day, you know, it really breaks us down. And I went through my own emotional health and wellness challenges. I got to a point where I couldn't take the stress of the high pressure position in entertainment. No one cared about my personal well-being, you know, on the surface. And it really took a mental toll on me. And that's why I walked away from my job and came back home to Atlanta. Went through some ups and downs again of I was embarrassed that I felt like, okay, I wasn't this woman with this big title behind me making all this money. So was I weak for walking away? Was I weak for trying to take care of myself? And that actually led to my suicidal ideation in 2015. And that's when I got the help that I needed and started the Silence the Shame movement. But since I've been doing this work in mental health, I just want women, and especially our Black women, to know that you got to take care of yourself first, like Dr. Sherry said. And guess what, ladies? No is a complete sentence. You cannot be everything to everybody, and that is okay. Therapy is not just for white women. Therapy is absolutely for Black women as well. Just ask Dr. Sherry. You hear her every week on Mental IQ talking about this. It is okay to not be okay, but what's not okay is to get help when we need it. And so we need to start being okay with recognizing, acknowledging, and processing through our feelings as Black women, and take that cape off, wash it, throw it in the dryer, send it to the cleaners, and recenter yourself and re-up when you need to, and place yourself at the front of your wellness priority.
Well, I appreciate you sharing that. I think we honestly have to take an inventory about how honest we want to be about who we are. And I think that's what makes us most ashamed when you have thoughts and crisis or lack of support. You know, your childhood follows you all the way into adulthood, and who are you? And they say, I'm you at 7 when your daddy left the house and didn't call for 3 years, and then started calling back with toys and trinkets and wanted to establish some relationship. And you said you like the invisible man, but nobody wants to talk about that at that moment. And we carry it up through our entire lives. Dr. Stevens, you have a perspective. We are now getting ready to prepare for a new dimension in understanding that mentally we have to change and be okay with staying in place.
Yes, absolutely. Part of the reason why our numbers are exponentially growing is because so many people, when we were sheltering in place, felt like they were being captive or held against their will. Because I'm not a clinical psychologist or behaviorist or anything like that, but I do know, just based on my experiences with working outbreaks and epidemics, that people feel like their rights are being taken away, or that, that they just can't cope. So as soon as the shelter in place was lifted, people totally forgot about why they sheltered in place in the beginning. And that's the problem. And so, and with that, and it is mental, because either, I look at it this way, either you're not comfortable enough with yourself to be with yourself or your family, but these are the people that you chose. So you have to deal with it the best way that you can, but you can't run away from the decisions that you've made. And unfortunately, by going out and having reckless behavior when it comes to a pandemic or an infectious disease like COVID-19, you have to take not just your feelings of being cooped up or tired of being in the house into consideration, but also that of the people that live in the house with you. And yeah, I'll stop.
Now, I think we might want to hear it. It really makes me sad to know that a super sister on the front line, mayor of a city, being selfless, talking to frontline workers, having to explain police behavior to parents, getting there to comfort the workers, having people walk off, having a person shot in the back twice while at a Wendy's sleep, and then having to all of a sudden wake up after being tested and share with the world now that she has COVID. I mean, that is a whole, I am naked in front of the world in a way that I never wanted to be. Never. And I'm just concerned. Everybody said, well, pray that away. Dr. Blake, can you talk about how prayer and the church and our mental are either working together or apart, or how do we create a system?
Yeah, first of all, I want to make sure I'm clear where people won't be writing me and saying, you don't believe in prayer. No, I definitely believe in prayer, but I believe in prayer. It's not prayer or therapy or prayer or treatment. It's prayer and treatment. It's prayer and therapy. Because in the past, the church has been the place we go to for everything, for crisis, for problems, and the whole bit. But when the church doesn't understand mental health, or they don't see mental health, it becomes a place that is very, unfortunately, and very unfortunate. It's a place where it can harm a lot of people because they think they can pray it all away. And it becomes a guilt problem and a mental health issue, because I've had so many people to come to me and say, well, it wouldn't be this way if I had prayed enough. Or a minister have said, or someone said, just keep praying. Well, you can pray, but you also have to do. And the reality is that in therapy and mental health, this is like any other part of your health. Mental health is part of your health. And you would not have a heart attack or have a stroke and look at that person and say, don't deal with a doctor, just pray it away. No, you would get help. Same thing in terms of mental health. And I do want to say there is a difference between, a lot of times when people think of mental health, they go straight to mental illness. Mental health is just an overview of your mental health. There is different parts of mental health, just like physical health. Everyone has physical health, but everyone is not physically ill. Same thing with mental health. Everyone has mental health, but everyone is not mentally ill. And rethink about mental illness, rethink about the stereotypic views we've seen on TV. And it's not like that. It's not like that at all. It's just an illness like everything else.
Shanti?
Can I add something?
Well, I was going to have you add something right now.
So I wanted to just share my testimony. When I seriously contemplated taking my own life in September of 2015, I called my sister, who unfortunately passed away last year. That's another webinar on grief that we could have. It's been the hardest year of my life. But my sister actually was the one who helped to raise me after my dad took his own life. But she convinced me to call the National Suicide Prevention Lifeline that night, which is 1-800-273-TALK. Also, I'm a member of Ebenezer Baptist Church. And I always wanted to be a part of a church where I could text my pastor in a time of need. And I texted Dr. Warnock that night, and he said, I want you to come to church tomorrow. He said, and I'm going to pray with you, but you got to go to the doctor. You got to get help. And so to your point, Dr. Sherry, I was very grateful that my pastor really understood what I was going through and understood the challenges. And, based on his recommendation and my sister, I called my primary healthcare physician that Monday and immediately got an appointment with a psychiatrist, and I ended up taking antidepressants. And so through also the work that we've been doing with Silence to Shame, we've been actually going into rural areas and communities and doing faith-based conversations around mental health, continuing to break down the stigma. And we started Silence to Shame Sunday, which is the first Sunday in May. And we ended up having last year over 13 churches recognize Silence to Shame Sunday. And it's an opportunity for them to talk about mental health through the sermon, because, Jesus even went through agony in the garden, and, he wasn't mentally well, in the Garden of Gethsemane. And so it's nice to hear pastors talk about that, but them also to talk about the resources that the church have, but if not, refer their parishioners out to get help. And so Silence to Shame is a big proponent on breaking down the stigma within particularly the Black faith community, so that they do understand everything that Dr. Sherry was saying, that it's not an either or, because a lot of times, even when I post, it's hashtag Jesus in therapy, because that's what saved my life.
Mm-hmm. Glad you said that.
Yes.
Well, I think there are lots of people looking for resources at this moment. I think we'll have them share the
1-800-273-TALK.
273-TALK. See, it has to be on your hip. 1-800-273-TALK. That was one of the questions. People said, where can I find help? This talk is sponsored by AARP and the conversation and role. We want to thank them for powering this conversation. But Dr. Blake, when you find the reason to make videos and share insights about mental health, give us 2 ideas that we need to spell that they can see in your videos as it relates to mental health.
One thing is, people need to understand, I try to help them understand mental health. And any type of part of mental health, it's not a weakness, it's something you have, just like you may have a cold, whatever. I also want people to know it's treatable. You do not have to just live in silence. You do not have to hold this all in, and you're not alone. A lot of people are suffering from anxiety, depression. There are a lot of common things. But one of the things I try to do through the videos and the whole bit is help people understand it's okay to get help, and understand the concept of mental health, the signs and the symptoms. Understanding that, also understanding grief. What is that really about? Because a lot of times we won't allow ourselves to grieve. And with COVID-19, we're all in a collective grieving moment, because we're not just grieving the loss of lost ones and not being able to go to funerals and have our homecomings as we used to. We're losing jobs. We grieve the loss of jobs, and not being able to have weddings and celebrations. Like, we're grieving a lot, and it's still grief. It's not that it's there. How do you cope? So one of the things I try to say is help is available, it's treatable, and you have to learn the appropriate coping skills.
I think the other coping skill we have is just the lack of following the right people. Dr. Stevens, when you give out your numbers each week, our community needs to set their mental based on science. I think one of the things that we want to set emotion. Can you help us understand how to apply science to the circumstances as it relates to where we are right now and all these other shenanigans? Dispel them?
Yeah, so first I just want to just tell everyone listening that you need to find your sources of truth on social media. There are so many people posting about the spread of the virus, and just it's just a distraction from what's really going on. And I always tell people that when you look at a virus, viruses aren't new, and you can track their behavior. And so I've worked with MERS, I've worked with Ebola. The plague hasn't resurfaced. Most people are like, oh, well, that's something new. People run down to Brazil. Brazil has had active cases of the plague for years. People just don't know. And so you just have to find your sources of truth, and also find your person. I post every day. I have people from all over the nation and now world reaching out saying, what about my numbers? And I give them the actual sources of information. So if you're going to listen to someone on social media or whatever, you need to ask them, well, what is your source? You're on here, you're talking about this, or you're saying that's not true, but what is your source of information? So I make it a point to always list my sources. Everything that I say is backed up with data and science, and this type of science is data driven. So when I was talking about how once the states opened up, the virus was going to start, the numbers were going to start doubling. And so that happened. Florida, it took Florida 4 months to have 100,000 cases. But once they opened up and then people stopped social distancing, they went up an additional 100,000 cases in 2 weeks. So when they sheltered in place, 4 months for 100,000 cases, 2 weeks for the second 100,000. And their numbers are going to continue to double every 5 to 10 days until someone steps in and say, okay, this is enough. But right now, with the leadership that we have, that's not happening. And unfortunately, you also have a group of people who feel like, well, if the leadership isn't doing it, then why should we? And that feeds into the whole idea that this is a hoax and they're just trying to control us. And I'm like, well, people are dying. Those numbers don't lie, because people are burying their loved ones and our numbers are escalating. Georgia today has reached over 100,000 cases, and it's only going to go up. So again, find your sources of truth, make a list. It needs to be people you can trust, and that they're sharing the same message, and that they're not bringing in information from popular sites or conspiracy theorists. So that's something to take into consideration.
I think this moment has been very awkward. It's kind of like wearing shoes that are way too tight. And you have to make it home. And you're walking on glass in a street. So you've got to just keep the shoes on and keep walking till you get home. I think most of us don't understand. Sometimes you need to be uncomfortable to live. The question is, how can we all be mental health advocates and at the same time understand that we have a role to share and heal and be healers and vessels of positivity versus the negativity seems to be clouding out positive messages? Dr. Blake?
First of all, we need to realize that mental health is part of your health. Is nothing to be feared. It's nothing to avoid. You just deal with stress like we deal with everything else. Deal with the anxiety, deal with the other issues. One of the things we also have to do is be available. It's not that we all have the right thing to say or know what to say to someone. Sometimes it's just being present. When you're distressed or you're in a crisis, it's not, don't tell a person what they should be doing or could be doing. You have to learn to listen. So we all have to learn to hear a person, see the crisis. A lot of times with mental health, understanding mental health means understanding that we're looking at how things affect your thinking, how you act, how you behave. So when you know a loved one's behavior has shifted drastically, you know that they're totally distressed about something or they're very depressed, be there for them. Help them get the help they need, because they may not see themselves as you see them. So it's so important to be available, understand it, so you don't put the stigma even more on. It's not on, girl, just get up. You know, I don't know why you're in bed. No, don't go there. Help yourself, help take the time to listen, understand what their crisis is about, where you can do something or get help for them.
You know, Shanti, you became an advocate. Why? I mean, why be an advocate? I mean, mental health. Obviously, we all want to advocate for better mental health. I know grieving is one of the issues that I think many people are going to have to work through over the next couple of years, because there are very few goodbyes.
Mm-hmm.
You know, you're lucky if you can see a loved one on a cell phone at this moment who's in the hospital. But why'd you choose to be an advocate? And I'll come to you next, Dr. Stevenson. How can we all be better mental health advocates? And what is that message?
So for me, I definitely did not choose this path. I think this is something, it's a ministry that God gave me. Oftentimes when people deal with adversities in life or overcome a crisis in their life, they become an advocate for that situation or something that they went through. And so it was, once I felt like God, gave me, the grace and the mercy to get the help that I needed. And because it was still such a big stigma in our community, I mean, more and more people you hear in our community are talking about it now, but even in 2015, just 5 years ago, it was still very hush hush. And for me working in entertainment, I was so embarrassed to share with my friends. Dr. Sherry, you and I share a mutual friend, Tanya Walden, and just be even opening up to some of my friends who had worked in entertainment before was terrifying for me. But what was interesting is when people started sending me private messages and DMs and texts like, oh my God, thank you so much for opening up. Thank you for sharing. I knew then that this is something that God had placed in my lap and I had to see it through. So what we can do to become better advocates around mental health is to, one, not judge, right? Because when people are dealing with mental illness or mental health challenges, we don't need you to fix us. Sometimes we just need that ear, right? So if you can have a little bit more compassion, have a little bit more empathy, and be willing to listen to people. The other thing is getting educated, right? It's a lot that we can learn. At Silence to Shame, we offer free mental health first aid training. It's a lot of organizations. You can Google mental health first aid and find, classes in your community. Also, we're about to start offering QPR training, which is, question, persuade, and respond. And that assists you in learning how to deal with someone if they're having suicidal ideation. So we're starting to offer that in July. The other thing is, it's important to note that, May is National Mental Health Awareness Month, but July is dedicated to people of color. Historically, it's been called, I think it was coined it was 2008 or before that, Minority Mental Health Awareness Month. But now, because, we want to be more inclusive with certain communities, it's now referred to as BIPOC, which is Black, Indigenous, People of Color Awareness Month. So get educated, get informed, and then share that information. It's important that those of you that are even listening today, take this information back to your faith communities, to your families, to your churches. We've got to start sharing this information, because that's the only way that you can break down stigma. And when someone in your family is going through something, don't call them crazy. Words matter. So we also have to pay attention to the words that we're doing and lead more from a place of love and positivity, and understand, as Dr. Sherry said, we all have mental health. We may not all have a mental illness.
Dr. Stevens?
Yes. So I guess for me, I always tell people that you need a strong no. And I have a strong no when it comes to just different things, and when it comes to my mental health. And when it comes to the pandemic, I've had so many people reach out to me, like so many people saying, asking me, how do I cope and how do they cope? Because this is something that they haven't seen before. Like, I've worked epidemics. I've been around this before. Never thought I'd see it here in the US. So it's a little different as far as like how Americans are responding versus someone in a developing country. They're more compliant, I'll say that. But I know how to cope. And so those who know me well, they've reached out to me, and I find myself telling them that you just take each day as it comes. And if you wake up one day and you don't feel like doing anything, not doing anything, don't do anything. But at the end of the day, you have to keep your health and your sanity at the forefront of your mind. And if you have to fast from social media or TV, like, I don't watch TV, live TV. I monitor what I allow into my space. And that goes from with like social media or people or just anything. You have to be protective of your space. And so that keeps me grounded, and it has kept me sane actually during this pandemic as well. And that's what I share with others. It's okay, as we said, our tagline, it's okay not to be okay. But don't let someone dictate to you what your okay is, because okay is different for everybody. But as long as you know that you're doing the best that you can, and you're taking each day and each moment as it comes, then that's all that you are required to do. And don't let anyone tell you otherwise.
Yeah. Dr. Blake, there is a couple of questions for some parents, because the dynamics of being around people that you're not used to being around every day, 24/7, is definitely increased and is off the chain. We see domestic violence going up. We see drinking going up. We see many of the ills of our society being bottled up in the house. How do we manage those new dynamics in the home during this pandemic and mentally stay stable?
Good question. First of all, you got to realize this is new. This is a new normal. Given it's a new normal, you're going to have to do things differently with children. And I know for a while, parents were trying to be teachers, shorter cooks, and everything else, and then the space would just sort of close in on them. Yes, and that's when the drinking and the domestic violence and all of the stuff we start seeing increase. But one of the things you have to do is get your house in order. Understand everybody's stressed. You're not in this alone. You're not expected to be the top teacher of the year or the top anything of the year. You have to pace yourself and organize your space in your day. Structure some things. Talk to your children. A lot of times we just assume that they just gonna follow our leadership. Talk to them. Use the language that's on the level of their age to explain this is different. We're going to have to do some things different. Have a ritual, have a schedule, take time out. Do not try to be the superwoman again to get everything done. That's not going to work. Pace yourself. Use this time to enjoy and understand your family, but most of all, use this time to sort of understand who you are. So once this is over, whenever it's over, what can you walk out saying, I made it through, other than, I've gained 10 pounds or 12 pounds. What have I done to be productive? And if you don't like, I think Dr. Stevenson said, there are days you may not feel like doing anything. And that's okay. I don't get concerned about those days. I get concerned when it goes 2 weeks or more, and all of a sudden you're still on in the couch in the same space. That's when I get concerned. So it's very important for you to understand, and for parents to understand, that you have to be human. This is a family affair, and we are in this together, and it's for everyone's safety.
You want to talk on that, Shanti Das, or? Because I've got a big one now for the women who are watching coming up.
Go to the next question. That's fine.
Okay. The question is really about key moments, and I've been waiting for this movie, because women have mental health, they got body changes, exacerbated, they've got emotional and physical alignment. pregnancy, menopause, death of a child, death of a parent, death of a loved one, um, Alzheimer's. All these are the things that happen to women. Add on breast cancer, lupus, any of those things, and they all come with emotional triggers.
Absolutely.
How can we cope? And what are the mechanisms to best help us manage our mental? Because I mean, I feel it.
I want to take a shot at that first because I think it's so important for us to understand that things that are happening, sometimes there are events that are happening in our life. Do not allow them to define who you are. Once things start defining you, then it changes you. So yes, you may have this, but that's not who you are. So you have to rely on a support system, form a support system that's going to be there. Form a support system that can pick up the slack when you're not able to. And I think so many of us as women, we again having that strong woman syndrome, we wear this cape and we don't ask for help. No one knows that we're going through things. And when people don't know, they can't reach out and support you. So it's going to be so important for you to allow people to be in that inner circle that you trust. Develop that support system so you can have someone to call. I noticed Shanti say she called her sister. I don't care if it's your sister, your best friend, call someone, your minister, but call someone that's going to understand, number one, mental health, and that it is okay to get help and it is treatable because we all go through things. And the more we can talk and the more we can share information, the less scary it becomes. And what's happening is a lot of times things happen and it's very frightening because no one has ever talked to us about it. And in families, we don't talk about diseases and what we're prone to have. We don't talk about that. So all of a sudden someone gets breast cancer and it's 10 years later, they find out, well, my aunt had it or my cousin, you're not alone. So share and get a support system so you're not alone and you can have that help when needed.
Can I add to that to echo Dr. Sherry's sentiments?
No,
So
no, you can't.
I want to talk about this one.
I'm kidding. I just, I don't see you that often, so I just want to always love on you the way I can. So
I appreciate you. So I mentioned that my sister passed away last year in April. And this has quite honestly been the hardest thing I've ever been through because I was only 7 months old when my dad died. And then my mom has Alzheimer's and she's had Alzheimer's for probably about 12 years now. So I've been grieving just the physical connection and that loss, right? There's symbolic losses too when you talk about grief. And so I've been grieving that physical connection from my mom for years. But my sister died and I talked to her on text just 6 hours before I got that awful call. It has been debilitating for me. And so to Dr. Sherry's point, I have set up accountability partners. And my mental wellness is still fragile right now. I go to therapy sometimes. I'm not in it as consistent as I should be, at least be honest about it. But I went through some really tough stuff last week. The headstone for my sister was finalized. That took me in a really bad place last week because it just made it final. And then I also had an argument with a family member. And I gotta tell you, I was so grateful that my friends checked on me and it didn't get on my nerves. It was all God and it was all love. They knew that I was going through some really, really tough days and they were there for me. The difference is when I was going through my really dark days, I didn't tell nobody, right? To Dr. Sherry's point, I didn't really need no help or I didn't want to be a burden on other people. Be a burden. Tell people I am alive on this webinar with Rolling Out, with Dr. K, with Dr. Sherry, with Munson, with AARP, because I told somebody that I needed help. I know now that just like it takes a village to raise children, it takes a village to support one another, especially as women, especially through the physical illnesses and the mental illnesses and through life. It's crazy right now. We're in a pandemic within a pandemic within a pandemic. Lean on the people that love you But guess what? Not everybody's gonna love on you the same way, right? So you have to be really careful. Like I say, who's in your starting five? Just like the Hawks got to have 5 players on the team before they can go out there and start the game. Get you a list of 5 people that you trust that you can call and that y'all can support one another through all of this. Because sometimes even when I get on the phone with my girlfriends, it takes me back to the 6th grade and puts me in such a warm place. And it takes my mind off of everything I'm going through. So we gotta have that as women. You gotta have that escape. You gotta have those accountability partners to keep you sane, to keep you alive, to keep you whole, and just to keep you happy.
Right.
Dr. Stevens?
Yeah, just to piggyback on what Shanti said, I mean, and even just going back to that strong Black woman sentiment, now is not the time to be a silent sufferer. And many Black women are silent sufferers. You have to speak your truth. If you're not okay, if your kids are driving you nuts, if your husband is driving you insane, tell someone. And it's perfectly okay to feel that way. But so many Black women have been shamed to thinking that if I don't love my family the way society says I should love my family, then I'm not okay. And that's not true. And especially during this pandemic, you're going to experience emotions that you never probably even knew existed. But tell someone, because guess what? Just because they're new to you, they're not new to other people. So that's why you have to have your circle, that protected circle, that protected space of people that's around you that you can say the most outlandish and outrageous stuff to, and they don't look at you in any other way but from a loving space.
That's right.
Well, Dr. Blake, you were shaking your head so much. I know you had something else to add to this conversation, you know.
I'm shaking my head because it's like, explanation point, it's so true. Because again, some people won't tell you the truth. And you need real friends, and you need friends to tell you the real deal and say, you need help. Or this is not, they have to keep you grounded. Because if we have yes people, or people are afraid, they're to say, that's not going to help us. So we have to have people that are going to be honest, that's going to be there 24/7. And I do an exercise in therapy where it's like a circle of friends. You should have a core circle, then there's an outer circle, then another circle, because all people are not going to respond to you on the same level. And don't get upset and don't expect it. It's okay.
I think the other thing that we might want to just share is how to share your emotions, because it's easy. I've heard all 3 of you kind of say. I know Dr. Stevens can be quite clear because she's a professor and she can be very pointed. And Shanti's had some experience, but many people who are watching this have no idea what a relationship with a counselor or a therapist is. They can't see. The only thing they see is, well, go lay down. Or they see the guy in The Sopranos who falls in love with his therapist, or they hear the horrible story that happened when they shared at the church. We need to understand the protocol, the relationship, the difference between a counselor, a therapist, and a psychologist and a psychiatrist. So if you could help me just share your experience there, and then I'll come back around to my other 2 sisters. Dr. Blake?
Okay, first of all, all the people you mentioned are helpers. We all have certain degree of training and expectations in terms of what we can do. A psychiatrist is a medical doctor that specializes in behavior, but the difference is a psychiatrist write medication. They assume that the issue is biological, therefore medication will be given. A psychologist is also a doctor, a PhD or PsyD or whatever, but it's a graduate level doctorate. In this case, we also realize it could be biological, but it could be your mama, could be your dad, it could be a lot of things. So we don't assume that it's biological. We look at the environment, we look at a lot of different interactions. With that, we do therapy, and a lot of times people say talk therapy. Therapy is not just talking. Therapy is really understanding the issues at heart. This is a science, like I said, this is health. So we understand that, and we have the highest degree to do that. We can make diagnosis, we do treatment plans, we do all the things to get you the help and get you where you need to be. And diagnosis is the key, because we got to be able to be clear on what that diagnosis is, so we know what treatment or what approach to use with a person. Then you have counselors. Counselors are people that have degrees in terms of counseling, and that's more dealing with social issues. That's more dealing with just very common issues, but it's not necessarily dealing with severe mental health issues. Same thing in terms of, I think you mentioned maybe coaches or whatever. Those people may have some training, but it's not training on different levels. So you have different levels of training, just like you have different levels of treatment. And it's very important for you to be able to recognize how to pick a therapist, how to recognize and ask the right questions. People don't ask the right questions. So you want to know, are you licensed? As a clinical psychologist, I'm a licensed, a doctor, I'm a licensed psychologist. So I have certain rules, certain guidelines, certain standards that I meet. Other people have licenses on a different level. It is very important for you to approach, when you're looking for a therapist, find somebody you can gel with. And I'm not saying gel with, hang out, be buddies, no, I'm talking about someone that's going to really hear you. It's very important to have someone that's competent in terms of culturally competent. You may not always, a Black person may not always be able to have a Black therapist, but the thing is that therapist culturally competent? Let me tell you why that's important. How many Black folks do we know? We all know them because we're part of it. They will say, girl, I feel like killing my husband today. Girl, I feel like choking my child. Or I wanted to beat him to death. You can't say that to people that don't understand what we're meaning. You can't say that to anybody, because defects will be at your door. You will be arrested. You will be on medication. So you got to understand, do they understand our culture? Or so often I hear people say, girl, I've been talking to God all day. Say that to the wrong person. So it's very important to pick the right person that has culturally sensitive, culturally awareness. And I think that is the key. If you get to a therapist and the therapist is not really hearing you and listening, that's not the person for you. This is not my hour, it's your hour. So I need to hear what you're bringing to the table, where I can figure out a treatment plan to get you beyond where you are.
You know, Shanti, if you would, I think the idea of taking medication really frightens people, and they have no idea how they often need to get balance back into their life. Can you share a little bit in this area?
Yeah, so I was that person. I didn't think I needed medication. I might take some Tylenol or Motrin every now and then, but something for my mind, I was fighting that for a long time. And it was my sister, I hate to keep going back to it, but she really was my everything. And she was like, look, if I hadn't been on Zoloft all these years, I wouldn't have made it with having to survive, raising y'all, having kids, having a family member also that suffers from bipolar 1 disorder. It was a lot. And so she was very unapologetic about having to take her antidepressants. And that kind of gave me some encouragement to say, okay, you know what, I'll try it out, since I actually had the suicidal ideation. Now, I will say the important thing about medication, it's like anything else. Sometimes when people are taking antidepressants or other, medication for mental illness, you have to make sure it's the right dosage for you. Like, my dosage was too high and it started making me feel jittery, and I didn't like how it was making me feel. That's why so many people go off of medication so quick. And it's important to note that if you start taking medication for mental illness, it is so important that you don't stop taking it abruptly, because it can have an adverse effect on your system. So what I did was I called my doctor back and I said, hey, I want to still try this out, but can we adjust my dosage? And she did just that. And it ended up working for me, and I felt a lot better. And eventually I weaned myself off of it. But just get educated and learn even about the different medications that exist. And I think it's important that if you are seeing a psychiatrist, that you do couple that or consider coupling that with therapy. That's something that I did not do and I regret. So then when I started, looking for another therapist, again, to Dr. Sherry's point, I had someone that wasn't culturally competent and I felt like he just didn't get me. So I stopped going for a while. And this was right before my sister passed away. And then when she passed away, I did start going to grief support counseling. So, it just depends. I think it takes a village. It's just like when an athlete gets signed to $1 million deal, you got your lawyer, you got your manager, you got your agent. Well, for me and my wellness, my journey, right, being this person that's trying to do the best that I can, I need a team around me. So I might need, somebody to help me from a counseling perspective. I need my pastor from a spiritual perspective. I need my psychiatrist, and I need my therapist. So do your time, do the research and take your time. And sometimes therapy is like dating. You got to keep swiping until you find the right one. But there's some great resources out there, like Dr. Joy started therapyforblackgirls.com. There's therapyforblackmen.org. It's a plethora of organizations out there that will help you find therapy. So many people now are charging on a sliding scale, which means that you pay what you can afford. Certain practices do that. And then, some people are offering free sessions just because of what's going on. So do your homework, do your research, check out all these organizations, and don't be afraid of just taking that leap. Because one young lady I talked to 2 weeks ago, she's like, I don't even know what to call and say. And I was like, girl, it's like calling any other doctor making an appointment. Hello, do you have any openings? I'd like to make an appointment. It's not that hard. It's nothing to be ashamed about. And you'll be better for it if you consider it.
Dr. Kenyatta?
Well, I guess I'll start out by saying this, it's especially in the Black community, and just looking at the numbers for the National Drug and Health Association that talks about how there's been an increase in marijuana smoking. So there have been people, especially people of color during the pandemic, that have turned to marijuana as their quote unquote quote drug of choice for dealing with their mental health issues. And so what I want to point out is that you would trust the person that's selling you your weed. You trust the weed man, but you won't trust a licensed professional. So I'll just park that right there, and we can go on to the next question.
Well, a lot of what we're getting is people who are suffering in their homes. There's a mother with 2 children that are both bipolar and trying to manage during the pandemic because their children believe that their drugs are making or numbing them. Mothers and wives are at risk. And I think, Dr. Blake, we've got about 8 minutes and we want to at least go back around each time. But as it relates to supporting our women and having conversations specifically with their men about mental health, I mean, I appreciate Shanti, but I don't want to uncouple this conversation because there are many men who have women in their lives who need to have some passage to getting mental health support. Can you share on that for 2 minutes?
Absolutely. First of all, mental health has no zip code. It can impact everyone. Mental illness can hit every home, not just males, females, old, young, it doesn't matter. We have to understand it. But as women, when we're there and we know our loved ones, our males are suffering, we have to be able to listen. We tend to try to do self-diagnosis and tell people what's wrong with them. Don't do that. Listen, hear, and then suggest maybe they go for help. Maybe you may need to escort and go with them to get help, but it's not something that you have to go and bang them over the head with, like you won't get up, you won't do that. No, a lot of times men respond differently than females to a crisis and to stress and to something. Sometimes they'll shut down, sometimes they'll get more aggressive, but we have to understand what's going on and is it outside the normal pattern. There is help available. There's help available through a lot of organizations. I tell people to call their insurance company and you can request, I need a male therapist, I need a African American therapist, psychologist, whatever the case may be, you have a right to ask for that. If you don't have insurance, there are a lot of organizations out there that will sponsor. But understand, for males, they hurt like everyone else. They cry like everyone else. May not show you, they may not talk to you, but they're talking to someone. And you have to be that support system to help them get the help they need.
Shanti?
Oh, I agree. You know, there is several organizations that we support. Black Men Smile is a great organization. I mentioned therapyforblackmen.org. Even just talking to some of my own friends and family members, like I've had to kind of intervene with some of my friends, talking to their wives, rather, helping their husbands understand that it's okay for men to cry, and it's okay for them to go through what they go through. You know, again, yeah, they're human and they experience emotion. You know this, Munson, like everybody else, but that's another thing from a societal perspective. You know, we've taught our Black men that they can't cry, you know, that they're weak and they're not supposed to show emotions. And that's really the dumbest thing I ever heard. You know, I appreciate men who can show some sense of vulnerability, right, and transparency and be open to getting the help. But we've seen a lot of these situations, you know, manifest through anger, through domestic violence, when it's ultimately issues that have not been addressed from a mental wellness perspective. And a lot of our men, they take it out on their family members instead of getting the help that they need. So we need to really foster a culture of wellness around our men and really getting them to understand that it's okay to show your emotions and to get help. And I'm just grateful that I'm seeing a lot more of our Black male celebrities and influencers opening up and sharing and talking about mental health wellness and making it a priority. So again, check out blackmensmile.com or therapyforblackmen.org.
Dr. Kenyatta?
Yes, just to again piggyback on what Shanti said, and I know a lot of the males that I've spoken to, just during this pandemic, they feel vulnerable, and that's a new feeling for them because men are fixers, and they feel like this is something that's out of their control, and that they don't know how to fix it for their family. And so that has brought on a entirely different wealth of emotions, and just trying to help them come up with coping skills. I always say, I'm not a man. I can't tell you how to be a man or respond as a man, but I can refer you to someone who can help you. And I think that's what we should do for family members, and especially wives and sisters. We shouldn't try to fix them, but we should definitely lead them to the right resources so that they can unpack what they're feeling and get proper help.
1 minute affirmation, Dr. Blake, on being mentally healthy.
It's okay not to be okay. Just get the help you need.
Thank you. Shanti Das.
Be unapologetic about your wellness, and remember that no is a complete sentence. You got to be able to protect your space and your peace, and that's really at the end of the day all that matters.
Dr. Kenyatta. Steve.
Find your strong no and set boundaries.
Boundaries. That's another webinar. We did not talk about setting boundaries. Ooh,
that's a whole nother, yes.
Boundaries is everything. Yeah. Get out my box. It's okay. Like, not today, Satan, not today.
Yes. Boundaries and having a strong no. When I say no, I actually meant no. It's a strong no. Mm-hmm. Mm-hmm.
So I want to thank you, ladies. We're going to go to Shanti's page. There's a wonderful resource there, so that we can take a quick look. That was good. That was great.
And I also note that on our website and on our YouTube page under Silence to Shame TV, we've done several webinars, which I want to get both Dr. K and Dr. Sherry at some point, but we've done one around grief and loss in a pandemic. managing relationships in a pandemic, postpartum depression in a pandemic, and just surviving COVID and your mental health. So we have a lot of content, and we also have a podcast with over 30 episodes up on Google, iTunes, and SoundCloud that may be helpful for anyone just trying to hear other stories of encouragement and wellness, and knowing that it is okay not to be okay.
Well, we could go on for another
It's
hour
7
for
o'clock.
sure. I really just wanted to make sure you all share your Instagram or your favorite social media platforms. Dr. Blake?
You can always find me at www.askdrsherry.com or social media at Ask Dr. Sherry info at the Ask Dr. Sherry. Quickly, I just want to thank AARP, and you can also go to their Black community Facebook and find videos and resources and tips about mental health.
Dr. Stevens?
I am on social media, Dr_KW Step on Instagram and Twitter.
And Shanti Das, I know you sent it to me, but.
At Shanti Das 404 on Instagram and Twitter, and follow us at Silence the Shame on IG, at Silence TH Shame on Twitter and Facebook.
Well, I want to thank you. It's been a wonderful hour. I enjoyed speaking to you. I know this is a traumatic moment. I want to thank AARP for supporting Health IQ. We are very concerned and want to raise the health IQ of our community here at Rolling. We want to thank you, ladies, for coming out, sharing honestly, and giving us a perspective so that we could uplift our community. Until next week, we'll see you again here on Health IQ. And thank you all. Much love, and definitely enjoy a new struggle every day, because it's going to be one. Peace.